Hey everyone, thanks for joining. Of course, here with Martin. Exciting video today. Going to be covering a bunch of people's questions. Took a bunch of them, also kind of slightly edited for context. We'll definitely do a much more general Q&A going forward. But first things first, Martin, how are you?
Doing great. Great to see you, Jason.
Awesome, awesome. So, for anyone who's not kind of recent, up to date, went out for questions in general, kind of about competition in biotech, and obviously kind of took those questions and adapted them to context. So, in no order, kind of just gonna fire through, and we'll see where we get. But to kick it off, so first one. What data is expected for Ona XR? Is there a way to benchmark this data so that you can compare it to historic trials?
So you sent me that ahead of time. I thought it was a fascinating question, right? And I'll give an analogy. Like it is almost impossible to compare asset classes if you're a general investor, right? Like how do you compare real estate to equities to bonds? And so typically you try to use a internal rate of return, and IRR. And it's imperfect, but it's the best thing we have to comparing returns, broadly speaking. Biotech for oncology drug development has something called a hazard ratio. And I'll spot that it's imperfect, and it's very hard to compare one trial to the next. But what a hazard ratio looks at is the relative risk reduction for a therapy. And in the case of oncology, it's lowering the risk of ultimately death or progression of the cancer. And so depending on your trial design, if you have a 30% risk reduction in your design and another drug has 15% risk reduction, you might be able to build an argument that we provided theoretically 100% benefit compared to the other company in the risk of, for example, your cancer progressing or death. So when we look at our own trials, I think one of the ways to look at that would be risk reduction. And the metric we use and similarly situated oncology companies use is progression-free survival. So the time that you start a treatment, however long you're on that treatment counted in weeks or months, and then ultimately the time when your tumors start growing. And typically it's when your tumors have grown by more than 20%, or new tumors have emerged somewhere else in your body, indicating that the drug is likely not providing a material benefit for the patient anymore. And so if you look at our trials in breast cancer, in our second, third line metastatic breast cancer trial, fulvestrant, which is currently the standard of care, has about a 1.8 month progression-free survival. So if we were to theoretically double that, take it to 3.6 months, the back of the envelope math would be a 50% reduction in progression. You basically divide 1.8 by 3.6. And so as we look at our trials and you look at kind of historical comps, anything really starting at a 25% benefit, but 30% or greater being kind of what most companies go for. That's what we're looking for in our trials and our upcoming data sets, broadly speaking.
Okay, there's going to be some amazing questions. Incredible answer. Want to also make sure people, if you're listening, you have other questions, please drop them below. I know Martin loves to do these types of videos and be happy to kind of include other people's questions. But awesome kind of kickstart. Kind of next one. What is your competition on Ona XR and Claudin 6?
Yeah, so competition is one of these interesting things. You don't want zero competition. You don't want to be the only person out there. It may make people wonder why you're doing something. And you don't want a zillion competitors. There's typically a sweet spot, and you want to have some ability, to navigate that competition and carve out a market for yourself. In our own XR program, competition is a little interesting there. So we are the only oral progesterone receptor antagonist in clinical development. So we are unique in that regard, and we view that product as really having no material competitors to speak of. However, we're also developing it in combination with another class of drugs called the anti-estrogens. And the anti-estrogens have a lot of competition. And people are constantly trying to make better anti-estrogens because those drugs have been around for 40 years. And so one of the ways that we're navigating that competition is we partnered with one of the leading anti-estrogen companies, a company called Menarini Group, in early August to launch a trial combining their anti-estrogen with our anti-progestin. And so we hope that combined force really creates potentially a differentiated product that is superior to the emerging competition out there. In the case of Claudin-6, it's a really new, hot, emerging oncology target, or at least we think so. There are two material competitors ahead of us. BioNTech, which just had its first clinical data that was quite promising at a conference called ESMO a few weeks ago. And then Amgen, which is a large multinational biotech company, just entered human clinical trials. And so for us, those two companies have very different products. Amgen has a BiTE, which is an antibody fragment. BioNTech has a cell therapy. We have a bispecific antibody. It's a full-length antibody. All different approaches, pros and cons to each. And so what we want to see is those two competitors ahead of us continue to establish proof of concept that the target blocking Claudin-6 or binding to it is beneficial, but we want to see chinks in the armor. We want to see, maybe suboptimal dosing frequencies or side effects that one wouldn't expect, ways that we can differentiate ourselves in our product. So I feel really good about the fact we have competition. It's not an overwhelming amount. And I think we have products that are sufficiently differentiated to carve out a place ultimately in the market based upon today's current competition.
Yeah, awesome. There was a part two to that I know you just crushed, but if you want to add anything to it, here's the part two. So as competition can be validating, but also too much competition can be challenging. How do you balance this? And you kind of you crush the add-on.
But I think to be fair, Jason, someone brought up, they did a quick search and said, okay, there's 100 products in development for breast cancer.
Yeah,
that's for sure. So let's start with why that's good. Patients are dying of breast cancer, right? So we want more competition, the better. That raises the bar, that benefits patients. The investors who pick those products that benefit the most patients will perform the best. So it's a scenario where ultimately, as far as the winners, from a product standpoint, people will win from all different sides. For us, breast cancer is a good example because cancer is not homogeneous, right? So breast cancer has three different groups. The largest is hormone receptor positive, which is what we're focused on. That's about 70% of the market. Then you have triple negative, which is about 15%, and HER2 positive, which is 15%. The vast majority of products in development are for triple negative and HER2 positive. There is really a dearth of innovation going on in hormone receptor positive. And so that's why we want to play in that area. Usually that means it's because it's hard, right? People don't tend to flock to what is hard. But the concept being that if you're a small company like us and you pick something that is hard, where there is limited competition, just enough that's validating, but limited, and you succeed, you really have built yourself a nice moat around your product because of that competitive environment.
No, interesting, great point. So yeah, you guys are played in a big field. Interesting the 70%. And the breakdowns were like that, and I'm sure that'll kind of generate some more questions potentially for a future video, which would be great. But amazing answers. Kind of moving through. I guess the question that is more like, what differentiates Ona XR from other late stage trials?
So Ona XR, a product itself, people have been trying to develop these anti-progestins for decades. And it's really hard to do. Hard to develop something that can be orally administered, which our drug is, that has a good safety profile, and that fundamentally blocks the action of its target, which is progesterone receptor. So the hard part is progesterone receptor can be activated in two ways. One is through the hormone progesterone binding to it. The other is through the protein actually being modified independent of progesterone and being activated, something called post-translationally modified. We've seen a lot of drugs in development just block progesterone. They totally miss that progesterone independent function. So what is unique and been published extensively on our drug is the fact that it has this dual mechanism of action of blocking progesterone receptor. So the drug's now in advanced development. It's the subject of a number of ongoing phase 2 trials, some of which will have data in the fourth quarter of 2022.
Exciting. This leads kind of perfectly into the next question, which was, and to use your words, how are you building a moat, as you call it, around these two drugs?
Yep. So taking it at a high level, just how do people do this industry-wide? You start with patents. And so patents last 20 years, and you try to file a number of patents that covers not just your product, but the various ways it can be used, manufactured, administered, et cetera, to file a serial amount of these patents to build a really broad, long, durable patent estate. Also, you have various protections in certain geographies. So in the United States, once you launch a drug, if it's what's referred to as a new chemical entity, so it's not a generic drug, it's a new drug, never been approved, even without patents, you would get directionally about 7.5 years of market exclusivity before a generic filer could enter. So those are structural ways that one can develop a moat around their product. And obviously, we have to publicly disclose the status of our patents. So in our various public disclosures on the SEC website. We're really proud of the patent estate we've built for our products. But that moat also relates to how we're designing our clinical trials, trying to develop data that is high contrast that investors can understand, building towards that PFS benefit that I talked about earlier, picking areas from a competitive standpoint where we can differentiate, where there is competition, but we can find an area, kind of a white space opportunity for our drugs to work. And so you take all these factors together and you start building inch by inch that moat around your product that creates something that's protectable, hopefully durable and valuable over time.
Love the answers. Kind of going on from this, then to change from defending to launching. So question here: how do you intend to launch Ona XR?
Yeah, so we've been pretty explicit in our public disclosures over time. While I would love to build a huge independent biotech company, and as we disclosed in an interview with Fierce Biotech this week, that's available online. The market's tough right now for biotech companies. We updated our cash guidance to Q1 2024. That gives us a nice runway. But we also disclosed that we're going to be really product focused for here on out until the economy changes dramatically for companies like us. So we're head down focusing. That means if our trials are successful, in all likelihood, we would want to find a much larger company to partner with who can take on that late stage and commercial risk, both from a trial standpoint as well as a financial standpoint in exchange for certain economic conditions. So that's a kind of a tried and true strategy for biotech companies. But we have to generate positive data first, and then be in a position to partner with one of the many pharmaceutical companies that happen to have existing women's oncology franchises.
Interesting. So this goes extremely well into really the last question that I had here, which was, someone said that the cost of complete development for Ona XR and Claudin-6 is quite high. And how do you intend to fund this work, and especially in the current market timings and everything else? So you just had a great partial answer. Anything you wanted to kind of add on top?
Yes, I mean, we are management are big investors in the company, and continue to be so. And so we like to think that we're aligned with our investors. We want to protect shareholder value, and that means doing whatever we can to offset dilution. And so to the extent that we can find a partner to bring in non-dilutive capital, and that's non-dilutive capital in air quotes, because you're selling some of the value of the asset to get that money. But if we can do that to offset future equity raises in the future, I think that would benefit the company, that would benefit our shareholders. And again, if you're partnering with a large pharmaceutical company that not only has deep pockets, but deep resources, that does theoretically offer the chance to expedite the development, get the drug in a much broader range of patients, and help more people. And that's why we're doing this.
Yeah. No, the partnership angle, obviously extremely exciting. You've talked about it before in previous videos, and I think that's a great answer. I guess here kind of the end of the questions I cherry picked out. I know there was a bunch submitted. Like I said, want to encourage people, please keep submitting your questions. We'll definitely do a bigger Q&A, going through. We love the general questions. So I think that was an amazing kind of adapted for context in terms of competitors. Anything else you wanted to add in? I know you probably got some questions too, but you think we did well, or do you want to answer anything else?
Oh no, I always think you do well. Look, it was an interesting week for the company. On Tuesday, we provided an update to guidance. So a new guidance for cash into Q1 2024. And we made it very clear that the cash we have on hand would fund two key deliverables for investors. The first would be phase 1b data from our ongoing clinical trial in collaboration with Menarini Group. That will be in the fourth quarter of 2023. And then for our Claudin-6 program, we had never previously disclosed when that program will enter human trials. We did that in this document, and that will be Q1 2024. So the idea was be very open, be very transparent about where we want to take the company, how we're thinking about shareholder value, and orienting people to the future. So we're really excited about that. We think we are as well positioned as a similar situated company could be, given the economic environment. And we look forward to continue to provide updates to our shareholders, patients, and clinicians.
Okay. Awesome. Well, Martin, I want to thank you as the last one. Thanks so much for answering these questions. I don't speak for everyone who submitted them, but looking forward to doing some more of these soon.
Thanks, Jason. Appreciate it.